I am Professor Dr. Samiullah. I am the President of the National Institute of Alternative Medicine Systems and also Chairman for the Federation of Acupuncture System of Therapy Board, Bengaluru. Right? I am running the Nature's Wellness Center, which is located in Nagar. I am fascinating to practice acupuncture, and since it is the non-drugless treatment methodology of the way of thinking. So in that case, I am very interested to treat the people without any synthetic medications. Honestly, I could not reach to that destination because of my family background, something like that. But again, I got the opportunity to enter into this field, and definitely since I came to know there is acupuncture is the only piercing the needle to treat the people. Since it is the acupuncture is the energy system, I understand. So based on that, the energy is circulating in our body. Once there is a stagnation or retention, that leads to the diseases based on the component of the 5 elements or Pancha Mahabhutas. So to balance that, to regain the energy, that's what I understand, because of the nature is imitating to the human system. So that's the reason I wanted to go ahead myself and to treat the people with the nature's philosophy and the laws of the natures. I completed basically is the naturopath degree, and further I wanted to learn some specialization. So that's the reason I completed the various courses and related to the acupuncture from the different countries. So then I visited to the China a few times, and they invited me personally for the China to visit to the various universities, Beijing University of the Traditional Medicine, and also Shanghai universities I visited, and then Tianjin Medical Universities. So many universities incorporatedly have done lot of research to understand the depth knowledge about the acupuncture. When I understand about the India and then China, of course the India is booming, like people are visiting to take the treatment through the Western medicine or the modern medicine. In the similar way, in Chinese, people are running to the hospitals where the traditional treatment to be given. When we look at about the nearly the acres of the hospitals are existing related to the purely they treat by using the herbal medicine, acupuncture and moxibustion, tuina, massage, acupressure, so on. Because emergency medicine is always their Western medicine, so that to be taken care for the few conditions. In the long-term diseases, for the long-term answers are existing in the traditional medicine, of course in acupuncture as well. So that's the thing, the people are moving towards the natural medicine without any taking the medicines. People are they are doing lot of research, R&D is there, and very quick results are there. Of course, every country having their own respective medicines, like Indian traditional medicine called as Ayurveda and Siddha and Unani medicine, so on. Whereas in China medicine also we call as a herbal medicine. 306 herbs are there in China, where they substantially incorporated to heal the people or treat the people by using those herbs. The people need to be incorporated by using the Indian herbs. Whereas if we are living in China, of course that time the Chinese herbs is more suitable for our health. But however, every country having some certain amount of the related environmental herbs which will be suitable for the respective countries. But however, the herbs which is Indian culture and Chinese culture, both are really doing well to the patient if they have taken the treatment in the preliminary level of the diseases. Acupuncture needles involvement is the insertion of the very tiny stainless steel needles on the skin surface to promote the impulses on the nerves and muscles and arteries and connective tissues to bring the restoring the balance in the whole pain relieving conditions, and also bring down the stress and the tension and overall well-being and wellness to the person. Overall, we look at about the various diseases from acute to chronic diseases. Around 70 to 80% of the positive results and success rates we can see for the known and unknown case of the diseases. For example, the migraine is there. There is a lot of relief, up to 80 to 90, sometimes 100% relief, and cervical pain is normally 100% relief, and back pain is maximum the patient feel changes. Of course, there is the comorbidity is there, the management diseases are there. For example, hypertension and thyroid and blood pressure. This and all maximum without much medication, the people can survive without any medicine. So in that way, we can manage those diseases. And of course, as a various medicines, but this is comparatively, it is the quick response for the few conditions and a slightly slow response for the few conditions. But overall, we look into that, it takes several months together, but that can be treatable in the short duration. Patient can get rid of their issues. Honestly, diabetes and hypertension, it is a lifestyle disorders in normally. So because of we made a mistake, that means the people making the mistakes which leads to the illness. So before that, how do you living style to be changed? So that metabolism to be taken place, and sleeping pattern, eating pattern, elimination pattern is good, then the patient feel healthy. So if this get imbalances, the origin to cause the problem in normally either it is diabetes or the hypertension, the abdominal system get changes. Where the gut and stomach and spleen and liver get imbalances, that leads to the diabetes and hypertension. So if the eating patterns are good precisely by using the more sattvic food than the rajas food, definitely that have the great impact. But by using these modalities, along with that we do the acupuncture treatment, definitely the people doesn't want any kind of the medicine to be continue the same. Yeah, timely it gets elevation. Around people says now after there is some kind of the fatigueness or lethargy or some illness, so that time the people will going to check the hypertension or diabetes, that slightly gets above the margin level, that gets the panic that I have the hypertension or diabetes. But what could be the reason, we need to understand. So once we do the prevention, later it will be all right. So in that way, definitely acupuncture with the environmental laws and then natural laws, definitely we can maintain without any medicine. The people who have 140/90 blood pressure or 140 or 150/100 blood pressure at the age of 60 years, they need not to worry about it for as per their age. So that's normal for them. If the young generation is there, for them 120/80, 130/90, it's a quite normal. For example, a person who have 40 years old, he have 130 or 140/90 blood pressure, we need not to worry to take the medicine. But every individual person having slightly changes, 100 to 140 is the systolic blood pressure, and below is the diastolic is 80 to 100 blood pressure, that could be, seems to be normal. So therefore, we can maintain without any medicine, definitely by using the acupuncture. Normally, I deal the patients with the chronic diseases, as I told you, the people who are suffering for the walking disability and cervical radiculopathy, lumbar radiculopathy. We called medically, it is sometimes it is essential the surgical level of the treatment. And the people are very, very in habitual financial situation. So that time they could not afford for the surgery, and they requested me to do that. So further I told it is required the surgical treatment, but we could not able to do much. But still they told me, yes, no doctor, you can able to do. So then I take up that case, and today without any disability the people are walking. That's really awesome. So certain conditions where I give the hopes is not possible, the patient giving me the positiveness, is it possible? In that way I took the patient. So I treated. Couple of the cases are without any surgery. When we look at about the acute appendicitis or lumbar spondylosis or the low disc herniation, lower back disc herniations, all are successfully treated for the few conditions. Of course, few conditions I need to refer to the super specialization to take care of the cases. Some of the patients comes to us with some enthusiasm, yes, wanted to take the treatment, and somebody is suffering in their respective families, and will go and say that they pierced 1 or 2 needles. If they imagine that needles pierced, then they says that I don't want to come for the treatment. So in this way they are planning to come, but they don't want to take the piercing needle treatment. So that was the fear is existing with the most of the patients. But in fact, honestly, I am telling you, needle is very thin, less than our hair. So in that case, once I insert the needle, and most of the places there is pain free, and the patient doesn't feel that I inserted the needle because of that technique. Of course, there are the very few places it has some minimum amount of the pain. Otherwise, acupuncture is not at all much painful to the patient. Easily everybody can be accepted this. Some of the doctors says, and this is really, it causes the neurological damage and some other problems or organ get disturbances. Definitely we are not directly inserting to the nerve. Of course, it releases the nerve impulses and muscles and connective tissues, but whereas we don't insert the needle to the nerve or directly artery. It promotes to flow of the chi and blood and body fluid. That is the major science behind this acupuncture. So therefore, there is people says it is a pseudoscience or something like that. Of course, everybody think in the different level. People will understand Western medicine is good. Some people go for the Ayurveda, so on. So acupuncture is normally even anyone from at the age of birth or the 1 year to till 100 years, we can able to provide the treatment for their needy illness, sick community conditions. I respect all the system of the medicine and methodology of the treatment. But here is the government of India and international level and also the state level, the government medical organizations, colleges and hospitals and organizations, Indian Medical Council, Indian Medical Association and also the Indian Medicine councils and ICMR. It is essential to support and to promote this is the non-drug treatment to reach to unreached community. But this having the some issues with the political level which could not lead to that level. But still we are fighting for the same in order to bring the legislation and also bring the 5.5 years is the professional course for the acupuncture, which comes under the health university. Since the World Health Organization also approved in 1979 and also the government of India also recognized the acupuncture system of the mode of therapeutic system. In 2019, the government of India brought the one office order stating that acupuncture wanted to bring down as a independent healthcare delivery or the independent healthcare system. There is a course called as a Bachelor of Naturopathy Yogic Sciences. In that there is one subject people study acupuncture. But whereas in government of India has given the notification in 2003, 2010, 2018 orders stating that acupuncture can be practiced by the medical doctors or the Ayush doctors or the appropriately trained personnel can practice acupuncture as well. The people who have the PUC science background, definitely they also enter into this field to study as a diploma in acupuncture therapy or something like that. These courses are existing today. So after learning these courses, definitely they can work as a therapist but not as a professional doctors. We wanted to promote acupuncture. People are not aware of that. So normally there are 500 nearly practitioners are there in Bengaluru and across the Karnataka greater than amount. And definitely this awareness is more essential to promote this by doing the various camps, and also we are teaching academically. And since I am the lecturer and a professor on the acupuncture, and I do teach to the people every Sunday. So in that case, the people are studying, hundreds of students, and they are practicing as a therapist. And in this way, we are, introducing this, and definitely in the span of the another 5 years, and more number of the people can be practiced as a therapist and professional doctors as well in future. The millions of the people are there on the earth, but among them God will select very few of them to do something to the service directly to the humanity. Here I wanted to remember Dr. APJ Abdul Kalam. He said few words for the doctors. The virtue of the doctors is required on the 4 levels. One is the intelligent to be there, pure ethics should be there, and mind of generosity is there, and kind heart should be there. So for all of you, there are one biological heart is there, but for the virtue of the doctors, he said, there are the 2 hearts should be there. So one is the biological, the second is the kind heart should be on the towards the compassion towards the patient. So that's what I understand. I took that mission to my mind. Yes, I wanted to do something for the betterment for the directly to the sick community. So that's what here. So in that way, the people to understand their pain, right? So we have to take the patient pain on our head. So we have to take the case of the patient illnesses or disease by keeping ourselves in that position. So in that way we wanted to, because of the ethics, and also there is the oath says, so we have to treat with the wholeheartedly. So that's what we are doing the same. And also I am passion to teach to the people with the international literature level and international credential level, but I wanted to reach to our students or non-students also, so they can, I am also learning till my last breath, but the same technology of my learning to be reached to unreached community of the people who are seeking this kind of the education. And also we are running the Federation of Acupuncture System of Therapy Board. It is the autonomous board, so which providing the education and also providing the diploma level, bachelor level, master level programs to the students based on the university curriculum levels. So all our education belongs to the international benchmark standards. So that's what I visited for the 5 different countries. In fact, I addressed nearly 16 countries of the people, and that curriculum of the various countries I am addressing to the Indian people, even that can be benefited by our students. I am available in the Shivaji Nagar Center morning 10:30 to 3 o'clock in the noon, and in the evening time 6:30 to 9 o'clock I will be there in Nature's Wellness Center situated on the Sultan Palya, RT Nagar, Bengaluru. Right? We deal with the patients of the naturopathy, acupuncture, acupressure, cupping, and also Unani system of the treatment, and my wife also participating with me. So we together is the holistic approach to treat the people by using the Unani system of medicine and acupuncture, acupressure, hijama, cupping methodologies.